The world of high acuity nursing is both exhilarating and demanding. Nurses in these settings care for patients experiencing the most critical medical conditions. From heart attacks to respiratory failure, these patients require constant vigilance and expert intervention. The NCLEX exam recognizes the importance of this specialized area. It rigorously tests your knowledge and ability to think critically under pressure. Mastering high acuity care goes beyond memorizing facts. It demands a deep understanding of the human body and how different systems interact. You'll need to quickly assess complex situations, prioritize interventions, and adapt your approach as the patient's condition evolves. This is not just about passing an exam. It's about developing the skills to save lives. The journey to becoming a confident, high acuity nurse starts with a strong foundation in the basics. We'll cover essential skills like IV fluid administration, parenteral nutrition, blood product administration, and tube care. From there, we'll delve into specific body systems, exploring common conditions and their management. Get ready to challenge yourself, expand your knowledge, and emerge a more confident and capable future nurse. Let's start with the cornerstone skills. Every high acuity nurse must master IV therapy, parenteral nutrition, blood product administration, and tube care. These procedures are the backbone of critical care, ensuring patients receive life-sustaining fluids, medications, and nutrition. IV fluid administration is more than just connecting a bag to a patient's vein. You'll need to understand different fluid types, calculate flow rates, and monitor for complications like infiltration or infection. Parenteral nutrition, the delivery of nutrients through a vein, requires careful calculation and monitoring of electrolytes and glucose levels. Blood product administration is another high-stakes skill. You must be able to identify different blood components, understand compatibility, and monitor for potentially life-threatening transfusion reactions. Finally, tube care encompasses a range of interventions, from managing nasogastric tubes for feeding and decompression to caring for tracheostomy tubes that assist breathing. Mastering these fundamental skills is not just about memorizing steps. It's about understanding the underlying principles, recognizing potential complications, and intervening quickly and confidently to ensure patient safety. Now, let's dive into the fascinating and complex world of different body systems. Each system presents unique challenges in the high acuity setting, requiring specific knowledge and skills. Integumentary system, burns, severe infections, and complex wounds require specialized care. You'll need to understand wound healing, infection control, and pain management. Hematologic, oncologic system. Patients with blood disorders or cancer often have compromised immune systems and require meticulous infection control. You'll need to master chemotherapy administration, manage side effects, and provide emotional support. Endocrine system. Hormonal imbalances can lead to life-threatening conditions like diabetic ketoacidosis or myxedema coma. You'll need to understand hormone regulation, interpret lab values, and administer medications like insulin. Gastrointestinal system. From gastrointestinal bleeding to acute pancreatitis, GI emergencies require quick thinking and decisive action. You'll need to manage fluids and electrolytes, administer medications, and monitor for complications. respiratory system. Respiratory distress is a common reason for admission to high acuity units. You'll need to master oxygen therapy, mechanical ventilation, and airway management techniques. Cardiovascular system. Heart attacks, arrhythmias, and heart failure demand rapid assessment and intervention. You'll need to interpret EKGs, administer medications, and assist with procedures. Renal, urinary system. Kidney failure and acute urinary tract infections can quickly become life-threatening. You'll need to understand dialysis, manage fluid balance, and administer medications. Neurological system. Strokes, seizures, and traumatic brain injuries are neurological emergencies requiring specialized care. You'll need to assess neurological function, administer medications, and monitor for changes in level of consciousness. Immune system. Patients with compromised immune systems are vulnerable to infections. You'll need to understand infection control measures, administer antibiotics, and provide supportive care. This is just a glimpse into the complex world of high acuity nursing. As you delve deeper into each system, you'll develop the knowledge and skills to provide expert care to your patients. In the high acuity setting, recognizing subtle changes in a patient's condition can be the difference between life and death. Patients may not always exhibit dramatic symptoms, making it crucial to be attuned to early warning signs. These subtle cues often signal a deteriorating condition before it becomes a full-blown emergency. For example, a slight drop in blood pressure, a subtle change in breathing pattern, or a new onset of confusion can indicate a worsening situation. Developing a keen eye for detail and a deep understanding of normal physiology is key. Regularly assess your patients, compare their current status to their baseline, and trust your instincts if something feels off. Don't hesitate to communicate your concerns to the healthcare team, even if the changes seem minor. Remember, early recognition and intervention are crucial to preventing complications and improving patient outcomes in the high acuity setting. Section 5. Evidence-based practice. Your compass in the storm. In the ever-evolving world of medicine, nurses must stay abreast of the latest research and best practices. Evidence-based practice, or EBP, is the cornerstone of high-quality care, ensuring that interventions are grounded in scientific evidence, not just tradition or personal preference. EBP involves integrating the best available research evidence with your clinical expertise and the patient's values and preferences. It's about asking questions, critically evaluating research, and applying findings to your practice. For example, when caring for a patient with sepsis, you might refer to the latest Surviving Sepsis campaign guidelines to guide your interventions. Or, when deciding on a pain management strategy, you might research different pharmacological and non-pharmacological options to determine the best approach for your patient. By embracing EBP, you'll be equipped to make informed decisions, advocate for your patients, and provide the highest level of care. Section 6. Critical thinking, the heart of expert nursing care. In the fast-paced world of high acuity nursing, there's no substitute for critical thinking. It's the ability to analyze information objectively, identify patterns, and make sound judgments, even under pressure. Critical thinking is not about blindly following protocols. It's about understanding the why behind every intervention, and adapting your approach based on the unique needs of each patient. For example, if a patient's blood pressure suddenly drops, a critical thinker doesn't just reach for the nearest vasopressor. They consider potential causes, assess the patient's overall status, and select the most appropriate intervention based on the individual situation. Developing your critical thinking skills requires practice, reflection, and a willingness to challenge assumptions. Ask questions, seek out mentors, and embrace every opportunity to analyze complex situations and make informed decisions. Section 7. Putting it all together. A sample scenario. Imagine you're caring for a patient admitted with acute respiratory distress. They're struggling to breathe, their oxygen saturation is low, and you hear wheezing sounds from across the room. This is where your high acuity nursing skills come into play. First, you quickly assess their airway, breathing, and circulation. You administer supplemental oxygen as ordered and notify the physician immediately. You anticipate the need for a chest X-ray to rule out pneumonia or other complications. As you monitor their vital signs, you notice their blood pressure dropping and their heart rate increasing. You recognize these as early warning signs of worsening respiratory distress and potential respiratory failure. You prepare for possible intubation and mechanical ventilation, ensuring all necessary equipment is readily available. Throughout this scenario, you're not just following orders. You're critically thinking, anticipating needs, and collaborating with the healthcare team to provide life-saving care. Section 8. Beyond the books. Cultivating your nursing instincts. While textbooks and lectures provide a solid foundation, nothing can truly replace the experience gained at the bedside. As you progress through your nursing journey, pay close attention to experienced nurses in high acuity settings. Observe how they interact with patients, how they anticipate needs, and how they maintain their composure under pressure. Ask questions, seek feedback, and reflect on your experiences to refine your skills and develop your own nursing gut. This intuition, honed through experience, will become an invaluable tool in your nursing arsenal. Section 9. Confidence through competence. You've got this. Mastering high acuity nursing is a journey, not a destination. It requires dedication, a thirst for knowledge, and a genuine passion for caring for the most vulnerable patients. Embrace the challenges ahead, never stop learning, and trust in the skills and knowledge you're gaining. Remember, the most important tool you possess is not a stethoscope or a textbook, but your own sharp mind and compassionate heart. You've got this.